So I'm going to talk about three things, and I'm not going to talk about Pharmasave per se. What I'm going to talk about is more about the industry of community pharmacy and how it fits within the whole healthcare sector, and in particular, the innovative side of healthcare sector. And I'm going to talk about where have we been, where are we heading, and how are we going to get there, and then make some comments around how that impacts healthcare. So where have we been in terms of community pharmacy as a sector? And there's a couple of contexts here. First of all, the external context. I think if you look back even a few years, because I can't look back much more than 3. Well, I could, but it would be unfair. If you look historically at the community pharmacy sector, there are a number of really defining external factors. An aging population, which is a phenomenal factor if you're in a business that is primarily focused on selling medicines. It's not the buggy whip industry. Secondly, an increasing diversity of product, a constant wave of new medicines to be sold through the pharmacy. An increasing demand for the products, both driven by the demographics, but also driven by the insatiable appetite that we have to resist the impacts of aging. Fourthly, very little interest from our regulator. And I remember in October of 2007, I'd been in the industry just a couple of months, and I spoke to an audience much like this, and I said, I have never seen a regulated industry with such incredible disregard and distance from its regulator. We should be very concerned about this. And of course, in this province, it's proven somewhat prolific anyhow. And the last thing was a very large public purse. Don't forget, the whole economic instability really hit the radar in the summer of 2008. Lots of people could have seen it coming if they were looking, but community pharmacy wasn't a particularly externally focused group. So those are external factors. Internally, inside the guts of community pharmacy, we had terrific product supply. There was this constant stream of new products coming, and we never had any issues about obtaining products for our patients and customers. Secondly, we had manageable competition. There was competition, but much like the legal industry, the competition in community pharmacy was quite manageable. This group operated in this dynamic, the big boxes. This group operated over here in their dynamic, the mass merchandisers. This group operated over here in the independent world, and we all knew where the lines were. It was quite manageable. There was no obvious acceptance of external pressures. We were delightfully occupied with examining the depths of our own navels, and nobody ever challenged us on that. There was a very strong patient focus, so there was a customer focus in community pharmacy, and virtually every pharmacist that you will speak to from the community pharmacy profession, whether in a large store or in a small independently owned store, has a very impressive connection with the interests of their patients and their customers. And lastly, there was no issue being raised by the regulators. Regulators, just like we were ignoring them, they were ignoring us. So internally, we were very, very immune from the world, at least we thought we were. And there was no burning platform for change. So that's where we were. So where are we now? Well, the platform is, what's left of it is burning embers. There certainly is a platform on fire. There is a drive to change. And so what are we looking at now? The demographic reality has not changed. The demographic pressures are still there, both in terms of demand for product as well as diversity of product. There is, however, a dramatic change in supply. There is a global shortage of supply of medicines, especially generic medicines, and that's not going to change. And community pharmacists who look at circumstances in Ontario or circumstances in Canada are missing the rest of the 97% of the market, and in particular India and China. And if we don't think there's going to be a global shortage of generic and other medicines going forward, we should just take a look at the curve, the demand curve there. So huge supply shortage of our major product. Persistent economic global instability. And one thing I will say throughout the day is I have been astonished that nobody has talked about global economic instability as being a key driving issue that is going to require us to innovate how we do, what we do, when we do it, who does it, how we pay for it, et cetera, et cetera. And if we think that any letter of the alphabet, whether it's J, W, or any other number or letter, is going to define the recovery in the United States or elsewhere, I think we are sadly mistaken. Global economic instability is going to continue for a long, long time. We've only just dealt with Ireland. We have the rest of the pig group to deal with. The Portugal, Greece, Spain are all going to come back, and then we've got to deal with the rest of Europe, and then we've got to deal with Asia and ourselves. So global economic instability is going to drive a lot in the health sector. Two last comments in terms of where are we at now. We have a completely unsustainable healthcare system in this country. Sorry, but I do think that's the case. Whether it's public or private, I don't care. It's unsustainable. And lastly, we have in community pharmacy a hyper-competitive market. Everybody wanted a piece of the pharmacy sector, and it's a jumble of competition right now, which in some ways is good, but in other ways is not. So how are we going to move from where we were to where we are now in a successful way? I've got a few points here. First of all, public policy counts. It counts big time in healthcare, and it counts in particular in community pharmacy. And I'm not saying it counts more in community pharmacy, but I have been astonished and dismayed how the community pharmacy sector doesn't pay attention to public policy. I am also in a positive way comfortable that the public policy initiatives, or the public policy goals, I should say, coming out of every jurisdiction in this country are the same. They use different language. British Columbia doesn't talk the same language as Ontario, and we never figured out, sorry Dominic, we've never figured out what language Quebec speaks on public policy, but if you can figure it out, it does actually sound the same, and there's about 4 of them. There's 4 public policy initiatives in health. Improve health outcomes for the citizenry, the taxpayer, the patient, however you want to describe them. Improve health outcomes. More efficient and more effective, accessible delivery of healthcare services. Bend the cost curve. And the last one is change the culture. We have to change the culture of the citizens of Canada around healthcare from one of entitlement to one of responsibility. If we drove our cars the way we treat our bodies, we would be fined. And every one of us has to be accountable for that. It's a simple decision. We either take responsibility for the way things are and carry on, or we take responsibility for changing them. And I have found community pharmacy to be completely separated from the public policy goals in deciding how community pharmacy will evolve. And I think that's dangerous. On the public policy topic of changing culture, I think it's great that we had the Deputy Minister of Health here today. I would have loved to have seen the Deputy Minister of Finance, of Economic Development, of Education, and a few other ministries, because there are few organizations in the country more siloed than our provincial governments. And until we have interministerial discussions, we will not change the culture around healthcare. The public policy in education that removes physical education and that doesn't have training on healthy eating, the importance of taking care of your body, your mind, and your spirit as part of the curriculum is actually a tragedy for all of us in healthcare and outside. So enough of that. So public policy counts. The second thing is values are important. And again, I have been a little bit surprised at how much we have not put values on the table in this discussion around innovation. In the public and the private sector, I think we pay lip service and throw a page in the annual report about our values. But if we don't actually make decisions on a valued basis, then we are never going to be innovative. So I think values count. Thirdly, public sentiment counts. And in my sector, we have been, while patient-focused, not particularly connected with the public sentiment. We have to talk the language of our patients. Things like, what's the line that we use in pharmacy? Expanded scope of practice. Expanded scope of practice. See, I can't even say it. I'm in the industry, I can't say it. Expanded scope of practice means absolutely nothing to a patient. Let's talk patient language rather than medical language. The last thing I'll say about how we're going to get from where we were to where we need to be in pharmacy, I use the line, "This ain't Kansas, Dorothy," and this ain't for sissies. This is going to be a rough ride, but we have to do it. First of all, community pharmacy has to recognize that we will continue to be the delivery system for the medicinal products in the healthcare system. We will deliver the pills and medicines for public and private healthcare to the patients that you want to get them to. But product delivery must be more technologically based. It must be more efficient. It is a product delivery system. However, product delivery does not drive community pharmacy going forward, at least not the successful ones. It has to be a service-based model. We have to become in community pharmacy an integral part of the frontline delivery of healthcare throughout Canada. You can call that expanded scope of practice if you want, but it should be the pharmacy as well as nurse practitioners, dietitians, et cetera, must be seen as an integral part of the delivery of basic healthcare in Canada. So that's the second thing. The third thing is we must look at funding this, and I think the current funding for the delivery of healthcare other than through traditional medical channels is not quite right. We're preserving the healthcare budget for traditional healthcare channels, and we're requiring all of the other innovative ways of delivering healthcare to be funded through other channels. If you want to deliver healthcare through nurse practitioners, through dietitians, or through pharmacy, fund it out of the healthcare budget. Don't fund it out of cost reductions in other areas. So I think that's a significant point, but it's a point that I think is missed. And we have to continue to be externally focused. So a couple of thoughts on innovation. What works or what, and this is where I'll be a little bit more Pharmasave focused because that's what I can speak about with a little bit of knowledge. What has worked for us in an innovative context? We actually treat innovation on 3 levels. We see innovation coming at a macro or strategic level through the groups that you would normally expect in terms of research and if you will, at our governance level. We see it coming at an administrative level through various offices, but most importantly, we see it coming through our stores, through the people that work day in, day out in our stores. We do not have innovation teams. We will never have an innovation team. We will never have a task force that talks about innovation, because innovation in our organization comes one pharmacist at a time in the most effective ways. That's not to say that we won't have strategic innovation happening at the board and the governance level, but it happens one pharmacist at a time or one store at a time. And just I will give one little pat on the back to the folks in our organization that have been innovative at the Commitment to Care and Service Awards last night, which is the pharmacy gala event where leaders in the profession are recognized. 5 out of the 14 awards went to Pharmasave. We've only got 400 stores. That was an incredible recognition of some of the things that have been done at store level. So 3 levels of innovation, but most importantly, innovation is iterative. We don't have a model that says this group is the innovation group. We create the innovation, and then some other group further down the pyramid implements and executes. Innovation is iterative. It's got to go back and forth. Stores come up with an idea, it doesn't work, it works well, it's going to work in Alberta, it's not going to work in PEI. It's got to be iterative. So that's the first thing. The second thing is what do we need to do in a leadership context, or what have we done in a leadership context to encourage innovation? 2 fundamental things. First of all, we are a very values-based organization. I mean, I actually do talk about values. I believe in them, and our decisions are based on our values. Secondly, they are also based on strategic goals. We have to know where we're going and what are the outcomes that we want. And then we've got a number of factors that we've built in, and some of them my colleagues have already spoken about. The permission to be wrong. You have permission to make spectacular mistakes in Pharmasave and be congratulated for it. So a very strong tenet around permission to be wrong. Now, that doesn't go to counting the pills that go in the bottles or making sure that it's the right medicine, but in terms of being creative in your thoughts. Secondly, let's listen more than we talk. Let's listen, and let's listen to people that we wouldn't expect to listen to. Let's listen to the chartered accounting industry, who were innovative far before the word ever came into the lexicon in pharmacy. Let's listen to the airline safety industry, etc. Keep the discussion focused on the outcome, not on who owns the innovation. I continue to be surprised and disappointed at how often innovation is focused on who's designed it rather than what the outcome is. It's an outcome-focused discussion. Two last things. Let's resist the strong temptation to pave the cow path. And I do think that in healthcare we do that a lot, and that's been referenced already before. Let's just not try and do what we've always done a little bit better. Let's be courageous and try and do things completely differently that have never been thought of before. And I constantly ask this question, why do we do this? And they've now in Pharmasave, they've given up with the answer of, we've always done it this way. Why do we do this? Let's really critically question why we do what we do. And then the last thing is surround ourselves with diversity. It's really easy to surround ourselves, whether it's in a management team or whether it's in any other context, with people who complete our own sentences. That's dead easy to do, and we're really, because it's so easy, we do it a lot. Let's surround ourselves with people who are completely different than us. Bring another lawyer into your healthcare sector and they will shake it up. But seriously, bring people in who are not from healthcare to help healthcare redefine itself. That's it. Thank you.